My name is Sean Fitzgerald, and I'm speaking to you today from Jasper, Alberta. I'd like to begin today's meeting by acknowledging that the College of Physiotherapists of Alberta's offices are located on Treaty 6 territory, as well as the Métis Nation of Alberta's Region 4, which has been and continues to be the home of many Indigenous peoples since time immemorial. The College of Physiotherapists of Alberta recognizes that Indigenous peoples have been helping many live healthy lives on this land long before settlers arrived. With that, we commit ourselves to helping move people forward in their journey towards a good life and doing so in a way that follows the spirit and intent of treaty, that of peace, friendship, and understanding. We also recognize that people from across Alberta and beyond are joining us today and encourage you to take a few moments to learn about the lands, peoples, and treaties with which you may be in relationship. It's my pleasure to welcome Shannon DeLenardo. Shannon is the Director of Anti-Fraud with the Canadian Life and Health Association. Shannon is responsible to build consensus on concerns important to member companies and for leading industry committees, working groups, and projects related to the mitigation of benefits fraud. She has held positions in compliance, regulatory affairs, and privacy, as well as being a Director of Compliance and Director of Human Resources. Shannon graduated from the University of Guelph with BA, Seneca College with Human Resource Professional Designation, and has a certificate in Regulatory Compliance and Legal Risk Management for financial institutions. Again, I'd like to welcome Shannon, and I'll hand this presentation over to you.
Thank you so much, Sean. I'm so excited to be here. I get so charged when people ask me to come and speak on fraud. And I'm realizing that there's quite a delay when I move a slide, so I apologize for that right up front. I guess, I want to just start with how many of you, even in the last week or month, have received one of those calls, that just stops your heart. It's either your credit card company or the CRA or a grandchild wanting money, and it just, everywhere we turn, we're subject to some kind of scam that's coming at us. And I will tell you, I work day in, day out in the fraud world, and every time that happens to me and my heart just stops, I'm like, oh, and then I'm like, no, you know what, this is fraud. So think about that. It's like, it's everywhere, and we're going to touch on that, so bear with me. When you look at the slides as I go through them today, you're going to see two very distinct themes. And I want you to realize I didn't perch together a presentation from like 6 other presentations, and that's why it looks this way. But rather, we've got some very standard CLHIA slides that we're going to be going through, and then we've got our fraud slides that we're going to go through. And they're two different topics, and they have two different looks and feels, so that's why it looks this way. So I did want to just acknowledge that at the start. So you'll see we've gone into our slide on our anti-fraud program, and this is what I'm going to be speaking about today, specifically the work that the industry is doing around benefit fraud. I don't want to go through and list the agenda. It's here for you to see, but really, just as a summary, I'm going to be taking you on a journey that the industry's been on around combating benefit fraud. But I need to start with that TV-type disclosure. So, when you're watching a show and it says this show may contain, offensive language, I will be using the F word throughout this presentation. So I hope nobody gets offended by that. So I'm going to jump right in, and fraud's seen in the news almost daily. And we saw some changes during COVID on the types of fraud that was being seen, but it's seen all the time. So in prepping for today's meeting, I saw a bunch of frauds in the news, so I thought I'd just highlight a couple of them. So people coming home from vacation to find out their house has been sold. Fraudsters sending emails saying that your antivirus has expired and that they've tried to process your payment. Mine, the one I got, was for $400 actually. And the invoice is in the attachment, and they're having trouble processing that, so can you please call the number attached? And what they're trying to do is actually gain access to your computer and your banking information, because they're going to ask you to walk through how you made your payment. And like I said, I got one and it was for $400, and I'm like, okay, this is fraud. Then there's the grandparent scam, which, just this morning I saw that 2 individuals in the Lindsay, Ontario area were arrested for a grandparent scam. And that's because a couple of grandparents were smart and said, yep, they'll give them money. They had to come to the house. They called the police. The police were there to arrest them when they arrived. But I got one of those last week as well. And I said to the person on the other end, well, I wish very, very much I was a grandmother. I'm not yet, so sorry. There's the taxi cab scam where, your card's not working right, but really they're switching it and giving you a different card instead of the one that you provided them. Election fraud we hear about. The interception of electronic transfers, COVID benefits, government benefits. It is everywhere. And while we know fraud's not specific to these examples that I've just shared, it's not surprising and it's most unfortunate that benefit plans are not exempt from being at the risk of benefit fraud. No matter the one thing that's consistent, no matter the sector, when fraud occurs, it can have far-reaching implications. So throughout my presentation today, I'm going to share some thoughts on the impact fraud and abuse has on private benefit plans, some trends that the insurers are seeing, what's going on with our partnership with our members to fight fraud, and how we can all be part of the solution in preventing benefit fraud. So I hope at the end of the session you'll take away a greater understanding on what fraud is, how you can protect yourself and your business, and how we can all work together to protect plan sustainability. But if you leave with nothing else from this session, I do hope that you have an understanding of what benefit fraud is, and that as an industry, we're very serious about fighting fraud. I'm going to take us back to our corporate look again for just a moment. And I'm not sure how many of you are familiar with the CLHIA and the work we're doing, but CLHIA is a voluntary association. We represent about 99% of Canadian insurers, and we represent them in all their lines of business. We kind of see ourselves as an umbrella organization. So if, we've got groups that focus on compliance, on privacy, on group benefits, on life, disability, and all those areas. So for me, it's on benefit fraud and the work that we're doing, gaining consensus with our members in terms of projects that we want to move forward, strategies that we want to move forward to mitigate benefit fraud. For the most part, CLHA is, an advocacy or a policy organization, so we do advocate for change on behalf of our members. And we are not operational. So when you're thinking of questions that you want to ask, I want to remind you that I don't investigate fraud. I don't process claims. I don't do anything that would be considered operational from our members' standpoint. I'm working with the members to build programs to mitigate fraud. More on that later. So every audience has those people that just thrive on numbers. So I couldn't not share some numbers with this group as well. So on here, on this slide that you're looking at, it's part of our fact book, which you can find on the CLHA website, and we've got all of the archived ones as well, so you can do some comparison over the years. I think what's important here is that insurers are protecting about 70% of Canadians against healthcare costs. That in 2020, because we're behind in terms of processing the book, it depends on, we need to get the stats from our member companies. So in 2020, the industry paid $36.6 billion out in claims. In 2021, which is this book, we paid out $40.8 billion in claims. Supplementary health care benefits increased from $26.6 billion to $30.4 billion. Drugs consistently leads the charge in terms of expenses, and in 2021 that was $13.4 billion. Dental second at $9.5 billion, and that took a bit of an increase actually, up from $7.2. And hopefully of interest to this group is the physiotherapy, which is 0.7 billion or 700 million. And you'll see on this circle diagram that we actually break down some of the paramedical services. And this is new to this year, so I can't actually compare, how much we paid in the previous year in terms of physiotherapy, for example. But I think the next slide really tells a tale about the impact that COVID had on benefits in 2021. So you can see that, again, we provided coverage for like 76% of Canadians. But in terms of the healthcare, drug and dental care, 30.4 billion, as I mentioned, which is up 14% from 2020. If we look at something like mental health, which had a really significant impact on people during COVID, and you can see it in the claims paid out, as an industry paid out $580 million for mental health support, which is up 45% from 2020 and 75% from 2019. So, like I said, everybody has folks who want to see numbers. I encourage you to look at this deeper. You can go into our website and see the whole fact book, but numbers kind of rattle my brain. So I'm going to move away from that, and I'm taking us back to our fraud theme. So just as at a high level, I want you to understand the difference between fraud and abuse. So fraud is when a person intentionally submits false or misleading information for the purposes of financial gain. There's an intent to this. An example of that could be claiming for services that were never provided. Abuse happens when someone's exploiting the plan. So they're either providing services that may not be medically necessary in order to max out benefit plans. You see it in the news, you hear about it at the end of each year, the use it or lose it mentality. If you don't use up all your benefits, you're going to lose that money. You're not going to have it next year. It starts fresh. I think what's important for folks to understand is both of these are important as it relates to sustainable benefit plans. Unfortunately, some employees don't see that abuse is an issue. They don't see it wrong to use up their benefits. Some of them have that sense of entitlement. My boss, my company has provided this to me. I should be using it. Or perhaps they're paying part of the premiums. And so, again, they think, well, I'm paying part of these premiums, so I'm entitled to use it. Sorry about that. They don't think about the impact that may have, where they could be, losing benefits, paying higher premiums, losing their job, the impact it has on their coworkers as well. So when we think about the cost and the sustainability of benefit plans, we need to be thinking about all fraud, abuse, and waste. Something that we get asked a lot is, Shannon, what's the actual cost of benefit fraud? How big is this? And unfortunately, in Canada, we don't actually know how much it costs. Fraud is inherently about deception. It's designed to go undetected. And so it's hard to come up with these concrete numbers about how much it costs. Globally, we hear often 2 to 10%. We used to have that on our website as well. But like I said, because it's designed to go undetected, we don't actually have hard numbers on it. So we've taken that down. But if we think back for just a moment to what I told you is being spent on benefits, and if we even think it's just 1%, it's huge. It's huge. I'm going to let you do the math on that because, like I mentioned to you in just a minute ago, that's not my forte. So what are some of the trends we're seeing? And when I say we, I mean our member companies. So there's those highly organized criminal organizations that's a huge concern, kind of at the center of the fraud sphere. But, plan members get involved in it. They get involved in it through the submission of electronic claims. Perhaps, I did one claim for, physiotherapy. I still have that paper claim. I can go in and do some changes and submit it again and get reimbursed for another physiotherapy treatment just by changing the date. There's identity theft. So people who steal a plan member's information and are sending in claims on behalf of them when it isn't really them who's submitting it. There's provider fraud. And sometimes, and I want you guys to know, we understand for the most part providers are acting appropriately. And sometimes you get involved in fraud, even unknowingly, or abuse, unknowingly. It was interesting. I was on a call yesterday with one of our member companies, and what they had found out was that a fraudster, I'm going to call him that, a fraudster had taken another provider's credentials, and they were submitting claims on behalf of this legitimate provider that never actually took place. So when they started seeing these fraudulent claims come through, they were reaching out to the plan members to get confirmation that they'd received the services, which they had not. And so they're like, okay, we're going to stop this particular provider from processing claims. We're not going to process any more claims for them. But then when they reach out to that provider to have a conversation, they're like, I didn't submit those. Those aren't claims that I've sent in. So it turned out that someone had taken their credentials and were submitting on their behalf. But the ripple effect of that is now the insurer knows that Shannon is a legit provider, but it does slow up the process of processing those claims because each time one comes in, they take a closer look and say, is this really Shannon or is it someone who's taken her credentials? Incentives is another thing that's a real problem. So, you join a clinic or you're starting your business and you see other people are offering, gift cards or gifts of significant value, not nominal value, but significant value. And you're trying to build your business. You're doing it to build up your business. And you see other people are doing it. But the challenge with that is by offering those incentives, you may be encouraging people to come in and utilize their benefits for products or services that aren't medically necessary, which drives up the utilization of benefit plans. And one of those incentives that we see on the physio side, for example, is partnering with gyms and offering, a 3-month free gym membership if you come in for physio. That's not a nominal value. So that would be something that would really raise some flags for our member companies. Another thing that they see are fake clinics. So in Ontario, for example, clinics are not regulated. So anybody can have a clinic. And so they'll open a clinic and they'll start doing processing of claims, but there's not actually a clinic there. It might be a warehouse. It might be a gas station. It's an empty building. It's just a fake facade that they're billing through. The hardest type to actually detect is collusion, and that's collusion between a plan member and a provider. So, you go in and the provider will say, okay, we'll submit this claim. I won't actually give you any products or services. We'll submit a claim for $100. I'll take 50, you take 50, and we both made some money. So, again, not a good thing to have going on. So there are a lot of different ways that fraud's taking place. Again, it's everywhere. But why do we care? We care because fraud costs everyone. It impacts plan sustainability. It puts patients' health and well-being at risk. It costs millions of dollars, and that's diverted from employers and members. And it consumer protection, too. There's a risk there. So we care all the way around. So now I want to get into some of the story that I was teasing you about at the start, the journey that we've taken. And again, I'm so excited to be here to be able to share everything that we've been working on. I've been with the association since 2017, and I've seen the evolution. I've been working hand in hand with members on what we're doing to mitigate benefit fraud. So happy to be sharing that with you today. So the history, yeah. We wanted to dream big, dream big. You know, every one of our member companies invests significant time and resources in fighting fraud in their own book of business. But we knew until we started working together, it was going to be, you know, they'd only be making a dent in it. So it was like, dream big, dream big. I'm going to invite you to sit on the edge of your seat and be prepared to be amazed. At least I hope you are. So timeline. Or in the early days, we had, you know, repository of information that we called PAR 1 and PAR 2. And that was information that was publicly available to our members, but it was really a repository around providers where disciplinary actions had taken through their college or association. So it was all publicly available information. We said, you know, what we said as an industry, we need to take a multi-pronged approach to mitigating benefit fraud. So we're going to do education and we're going to do industry tools. So that's kind of the approach we took. So we wanted to do an education campaign. I'm going to talk to you a fair bit about the education campaign, but we also wanted to have some tools. And those tools involved a provider alert registry and a data pooling pilot and a data pooling program. So, you know, it's interesting because when I first started doing these presentations, I talked about the things I just shared with you folks around the definitions and some of the trends that we're seeing. And I get kind of excited saying, you know, the industry hosts, the CLHIA hosts a tip line so that people can, you know, anonymously send tips to our member companies, whether you're a consumer or whether you're a provider around potential fraudulent activities you saw. We'd be involved in Fraud Prevention Month, and that was kind of everything that we did. And while we still host the tip line and we still participate in Fraud Prevention Month, we've really evolved. So what have we been working on? And that's what I'm saying. We've done an education campaign, which I'm going to go into some details around. We've been working on, you know, the provider alert registry and data pooling. So in 2017, we knew we wanted to educate Canadian consumers about the consequences of benefit fraud. So we set about working with a vendor and doing some research to make sure that we had the right audience. So people who had kind of a propensity to committing benefit fraud or could be exposed to benefit fraud through the services that they were leveraging through their benefit plan. We did some creative development and we focus tested it to make sure that the images that we were using would resonate with Canadian consumers. And so the imaging is what we heard back was, if you want this to resonate with people, it needs to be direct and it needs to be hard-hitting. We created a video. We did social media. We did billboard campaigns. We went huge. And what you'll see, like in 2018, we did a media release saying we're educating Canadian consumers on the fact that benefit fraud is a real crime with real consequences. And that's our image. Our image is an orange jumpsuit and handcuffs, because people did not realize how significant the consequences of committing benefit fraud were. So we were really excited to be able to launch this. Oops, I'm not going to move forward yet. So on our website for Canadian consumers, we have a quiz. We've got FAQs. We have a lot of information just to let them know what benefit fraud looks like, what the consequences of being involved in benefit fraud are. And I mentioned to you that we did a video. And, you know, I hope you go on to the Fraud is Fraud website just to take a gander at the video and then, the next step that we took. But anyway, the video shows an employee actually being walked out of their workplace for having committed benefit fraud. So, they worked hard. They got, they built their reputation. They got to where they needed to be. And then through committing benefit fraud, they lost it all. Sorry. And it shows them being walked out of the workplace and onto an elevator. And the elevator doors in the video actually slam. And we know elevator doors don't, but we wanted to give that illusion of, a jail cell closing. So that's why that slams. When we developed the consumer campaign, we started hearing from a lot of provider associations, the colleges, providers themselves saying, this is great, but what about us? What about educating the provider community as well on fraud? So we took a step back and said, you know what, that was always part of our bigger plan. We knew we needed to educate both sides of the coin. And we worked with the Extended Healthcare Professional Coalition, which is the nationally regulated healthcare providers, to develop a unique page for providers. And what we heard loud and clear was, if you think for one moment that an orange jumpsuit and handcuffs is going to compel the provider community to learn more, you're mistaken. And we heard that and we said, you're right. But they do need to know how to protect their patients and how to protect their practice. So on the website, although it is on the Fraud is Fraud website, there's a page dedicated just to providers. And it's this look and feel. It's much different. It's lighter. It's brighter. But it talks about how to make sure you don't get involved in benefit fraud and how to protect yourself and how to protect your patients. And on that page, we also have FAQs and we also have a quiz. And it's interesting because we do have metrics on, which quiz questions are most frequently answered incorrectly, which FAQs are visited most often. And we use that information, those analytics, to inform future campaigns, inform next steps. So we didn't stop with just putting a page on our website. We actually worked with the EHPC and we did some industry tools, educational pages, one-pagers on educating providers. What we heard was, while a provider spends a lot of money and a lot of time to be educated in their field, they don't know a lot about the insurance landscape. So we have an industry one-pager that educates you on the insurance landscape, who the key players are, what everybody's role is. It's not really talking fraud. It's educating you on who the players are and what their roles are. We have another one on incentives, because we know that incentives are attractive. They're attractive to use. They're used to build your practice. But what we really wanted to make sure people understood was, don't mix your marketing practices with your treatment practices. So market your business however you're going to market your business, but don't let it get intertwined with the treatment part of your business. And the other one was just some really quick tips on how to protect yourself and your practice. And kind of some things you should think about before you join a new practice, things you should look at. So again, those are on the CLHIA website, and I encourage you to look at those. Then we said, not everybody learns best through reading. So we actually did an educational video series, which is available, and certainly your group can have access to the video series if you don't have it yet. But it starts out with a baseline assessment about people's understanding around the insurance landscape, incentives, and protecting your practice. Then there's a video specific to each one of those modules and an assessment at the end of each one of them. And while you're your college or your association, whoever leverages the tool, can see how many people have accessed it. They don't know it was Shannon and whether I passed or failed it. They just know that it's a tool that's being leveraged. So that's kind of what we did for the provider community. But we're not done. We're not done because we know that the educational videos were successful. And what we also know is that during COVID, people moved. So where we thought maybe people had resided that had the greatest propensity to commit benefit fraud, they may have moved. So are we even getting our message out to the right people anymore? One thing we do know is that our audience are Canadian consumers that have benefit plans. So this year, for Fraud Prevention Month in 2023, we have created a computer-based training module very similar to the one that I just described to you for Protect Your Patient, Protect Your Practice, for plan sponsors, for employers to share with their employees so that they know what their role is in terms of protecting benefit plans, how they can stay on the right side and not get caught up in fraud. So we're really excited about being able to share that out in 2023. And part of that was feedback from the provider community, by the way. It's like, these are great videos, you're educating us, but make sure that the plan member knows too, because there's nothing worse than when a plan member walks into your office and says, the guy down the street is offering this and you're not. I can't come to you because you're not doing this, right? So we want to make sure that plan members understand it as well. And just before I leave this, one of the things that I would like to highlight around your practice, one of the things that's become more and more popular are wellness clinics. And wellness clinics have multiple disciplines under one roof. So there could be physiotherapy, massage therapy, chiropractic, all under one roof. And the billing is managed by that person at the central desk. And that puts you at risk as well of being involved in fraud that you don't even know about. It could be the person at the desk that's doing it. So that, the plan member comes in and says, I need more physiotherapy, but my benefits have run out on that. So I say, well, you know what, it's okay because your husband hasn't used any. We'll bill it under your husband's name. Or, you know what, you haven't touched your massage. Let's bill it as massage and under your name. So there's fraud that can happen that you aren't even aware of. So that's where that Protect Your Practice pointer sheet comes in very handy. So you can say, I need to be checking my invoices. I need to be making sure that my billing is done correctly. I need to be sure that my credentials are being protected. So I'm going to say enough on that right now. And I'm going to go to the Provider Alert Registry. And this is new, and this is significant. And I think it's important that providers are aware that the industry has this now. So remember at the start I said in the timeline that we had this PAR 1 and 2, and that was a repository of publicly available information. Well, our members said, you know what's really important? Not that stuff that's publicly available, because we can find that. What's important to us is the stuff that's not publicly available. So if you build us a repository for that, we will come. So we did. We built a Provider Alert Registry for our members to enter providers where they have done an investigation and taken an outcome. So we launched that just at the end of last year. We have 12 member companies that have signed on to use it. We have about 160, and there's close to 200 entries now on this Provider Alert Registry. And it's all provider types, dentists, orthodontists, physiotherapists, massage therapists. It's clinics as well as providers. A member company cannot post something unless they saw something in their data that raised a concern They did a comprehensive investigation, and they took an outcome on that investigation. So that's all that can go on there. Who it was, what they saw, who it was, and what the outcome was. Other member companies who signed on to using PAR can see those entries, but they cannot, I want to reinforce this, they cannot act on it unless they do their own investigation, which means they have to go into their own data, they have to see something in their own data, they have to have enough that would warrant doing an investigation, and they have to take their own action. So they cannot rely on this to just take an action. But I do think, from a provider standpoint, understanding that as an industry we do now have tools, it's important. It's important for you guys to understand that. The next thing that we wanted to do was data pooling. So let me tell you a little bit about data pooling. So for years we talked about wanting to do this. We talked about the fact that we realized that other industries, P&C and banking, had realized significant benefits from pooling data. And what that means is that, member companies send anonymized claims data to a vendor. The vendor does their background voodoo magic on those claims and returns to the participating members alerts. So if you have a provider who's acting outside the lines, we'll call it, and they, they're smart. They know our benefit plans very well. They know our systems. So they say, okay, you know what? We know if we bill 4 hours, there's not going to be any flags that are raised. Those claims will be processed without a problem. So we'll bill 4 hours. But we'll bill 4 hours to 5 different insurers for the same day. Now, when that happens and you pool the data, that's when it gets interesting, because now we see those impossible days. We see when someone's targeting a particular plan. When I say we, I don't mean me. I mean our members that have signed on to this. So they get to see very interesting trends and alerts. So, in 2018, as I said, we did our media release for the education campaign. In 2022, on February 14th of 2022, we were able to do a media release that's out there that says, you know what, we're doing data pooling. We did a pilot. We saw that there would be benefits within our industry, just as there was within the P&C industry, and we're going to go live with this. So on December 1st of 2021, we actually went live with the program, and on the 14th of February 2022, we announced it. We started with a manageable number of member companies, but since 2022 and into 2023, more and more of our member companies are joining the data pooling program. So what did I get? Like I said to you, we dreamed it. It became a reality. So what they see is alerts. They see alerts. They still have to go back into their own data. They still have to do an investigation. They do have the ability to reach out to others who are impacted by a particular provider. So if Shannon alerts, what they call alerts, with one insurer, and we can see that they're actually also alerting with 6 others, 7 others, those people can say, can we talk? Can we get together? Can we look at this as a group and do an investigation? That's where that program ends. It doesn't allow, it doesn't facilitate any joint investigations. It just connects people, companies that may have a common concern around a provider. So how do we make it so that we take it to that next step? That's the future. That's coming soon. I continue to dream. I have a few more years before I need to retire. So where is this taking us? We really hope it takes us to the point where we can start working together and doing joint investigations. We're not there, but we will be. I'm certain of it. We're going to get there. So I've talked a lot about a lot of the things that we're doing. I gave you some tips and tricks. I talked about some trends we were seeing. We talked dollars and cents for a bit. And as I said at the start, I hope if you take nothing else away from this presentation, take away the understanding that as an industry, we're taking mitigating benefit fraud very seriously. So I think that's all I have to share, unless you guys have some questions, which I'll do my very best to answer. Questions?
All right. Thanks very much, Shannon. That was great and actually quite, entertaining as well. So we do have a couple questions coming in. So one was, obviously the credential theft was one that was new to me. So it seems like it'd be quite obviously frustrating for both the business owner, the clinician, the patient to kind of have to deal with that. So what are there certain ways or kind of means like using, certain software programs that a clinic or practitioner could protect themselves from credential theft? I think we had talked before this started that, we had patients who, would take old invoices and redo them to reflect different dates. But is there ways that, a physiotherapist could actually protect their credentials?
So that's an awesome question, and I'm going to say yes, there are. And that's part of, I was talking about industry tools that we have. And so we've got on our website, on the CLHIA website, we have a page that's called Resources for Healthcare Providers. And on there, there's some tips and tricks around protecting yourself from identity theft. There's a great document on there. So, questions that you should think about. Could the computer clinic be hacked and your information stolen? What happens if your information, the clinic that has your information is sold? Are they taking that information with you? So there's some practical questions. What happens when I stop working at a clinic? How do I make sure that they stop using my information and are not submitting claims on my behalf, even though I'm not there anymore? So how do you protect that? So don't give out your license or registration until after you're hired by a clinic. And this is something that we used to talk about a lot as well. And that's those ads, Kijiji, or someone's posted an ad that they're looking for to hire someone. And through that interview process, they're asking you to provide, your name, your address, your registration number, your license number, whatever it is. And then you find out that job doesn't even exist. So you've handed over all of this professional information to someone, and there's not even a job there. So very similar to, when we were kids and it's like you have your social insurance number, you don't give that out until after you're hired, right? So make sure you're protecting all your information even during the interviewing process. And make sure that staff, clinic staff and owners, if it's not you and your college, have an agreement to the appropriate use of your professional information, particularly, around how claims are processed. It's really just being proactive and understanding how your clinic operates, and that you have the right to kind of audit the invoices that are being sent on your behalf. And for heaven's sakes, if you think that your personal information, your professional information has been compromised, go on that tip line that's on the CLHA website. Go in, you can report it to all insurers and let them know that you've got that concern so that they can be on the watch for it. I hope that answers.
Yeah, Yeah, we just had a follow-up question to that one, because I think kind of for us as physios, like when I submit, our invoice to the insurer, or I guess we provide on the invoice for the patient, bring that to the insurer. Really, it's just our name and license number that's needed. So, I guess kind of at the insurance level, is there other things you guys look at when a claim comes in, or is it really just that like name and registration number, and then you guys have a quick check to see if that PT is employed or is registered in Alberta or Ontario or wherever?
So, you know what, it's a great question, but right at the start I said, I don't pay claims, I don't see claims.
Yeah.
So
yeah.
Each of our member companies have operational processes, and I don't really know what each of them do, but I think that, they have access to your website where you've got those providers that are in good standing and that they cross-reference. But honestly, I don't know what other processes are around them.
Great. The other question that we had come in was around delisting, and what does delisting mean, and how does this differ from, say, criminal charges, and what do insurance companies kind of use to kind of decide what, I guess, kind of, to delist versus to go through the court system and the police when it comes to fraud?
Sure. Again, operational. So each of our member companies have their own policies and processes around delisting. Generally, I can say it's not something that they take lightly. So if they're taking a step to delist a provider, they've done a lot of steps prior to doing that. They understand this is somebody's livelihood. So, they've reached out. They've probably tried to do some education. They've been looking for doing claims verifications or audits. So it's not something that's taken lightly. It is something that can be done at the insurance company level, though, that will stop claims from coming in. So they delist, they notify their plan members that they're not accepting claims from this provider anymore. Doesn't prevent them from notifying a college or association for them to do their own investigation. And it also doesn't mean that it will never go to law enforcement or criminal charges. But it really depends on the size, I would say. If we're going to, police, law enforcement, they're looking for the kind of that sexy fraud, right? So they're looking for the big buses,
right.
And you see that in PNC all the time, right? So we want to make sure that, from a benefit plan standpoint, we're stopping it, hence the delisting. We want to make sure that the college and association's aware of it, so we're referring it there. And it does go to law enforcement. I mean, think about the one that I don't know if you guys saw it, but York University last week, so 10 days ago, announced that they detected fraud within their employee base. 2 separate departments in the University, York University, employees were caught. And that got referred to law enforcement. That's a big one, right? When it's a university, when it's employees doing that. Now, the fraud that they were caught doing was probably a collusion and required the cooperation of a provider as well, but I think it was orthodontics in that case.
Right. So then I guess kind of with the direction that you guys have taken with data pooling and all of these, I guess, increased kind of resources using, I think there's mention of like a, AI software to track kind of all of these things that were happening. So if there was like a provider that decided to delist somebody, I guess now at this stage, that's something that then is available to other providers that they can then kind of, it gets flagged in the system so they can do their own internal investigations.
Yeah, so they could see that a member company saw wrongdoing, or they saw suspicion on a provider, that they did a comprehensive investigation and that they took an outcome. If the outcome is at an insurer level, it simply says managed through internal process. So it could be that they suspended their ability to send claims in electronically up to delisting them. But the other insurers cannot, they're contractually bound. They cannot act on that without doing their own investigation, yeah.
Right. I guess kind of for us as a college, I guess for us, like with the discussions we've been having, it's probably a good time to kind of also point out that, for our members, that it's important to kind of go in and update their employment within our registration system, because that is something that is public and verifiable. So, I mean, if you want to ensure that your employment ends at a clinic, you need to kind of go into our system as well and kind of update your member profile to remove those employments. So I guess kind of that being said, and I'm not sure kind of you would know this since you're not in operation. So if, say hypothetically, I was up to date my employment location, so I've kind of removed, they know that I just work at this one clinic. Would you, do insurance companies, would they actually be able to confirm that, say if a claim came through, that you would kind of in that investigation be able to kind of track where the PT is currently employed? Do you guys, I guess kind of, again, this might be in more operations thing.
I'm going to say they probably reference that, Sean, but again, I don't know what their internal processes are around maintaining that. But I know that one thing that I do know is that when our member companies are dealing with, regulated professions, and the college or the association has up-to-date information and that they maintain it, that they do check that. And I think it's the Ontario College of Physiotherapists that actually send out a blast if they've taken an action. They send something right out to our members to do. So yeah, sorry.
No, that's been really good. And I think kind of for just again, from our role as a college, there was mention of incentives and things at the start of the presentation, and just for again, a reminder to our members is in our standards of practice, there is no incentives to access physiotherapy services. So it's not something in Alberta that would be, I think, available to physiotherapists. It's within our standards that, incentives and things like that just aren't provided. So whether it's nominal or significant, that's just something within, the standards of practice that wouldn't be allowed anyways. So just a reminder to our members who are currently listening and kind of as a heads up. And I think at this stage we have no other questions that are coming in. So I will take this moment to once again kind of thank you, Shannon, for doing such a great job presenting and the quality of information that you provided today. It was a good session. I think our members will find it very valuable.